Earlier this year, the Robert Wood Johnson Foundation at the University of Wisconsin released the County Health Ranking Study, which determined Collier County ranks #1 in Florida for health outcomes, indicating we are the healthiest county in the state. Every individual, agency, business, and healthcare provider in Collier County played a role in accomplishing this achievement. In this video, you will hear from some of the agencies that played a role in Collier County being ranked the healthiest county in Florida. As you listen, please think about how your agency contributed to this outstanding achievement and how, together, we can sustain this excellence.
Hi, I'm Sheriff Kevin Rambosk. Did you know that Collier County has the lowest crime rate of any metropolitan county in the state of Florida? And that over the last 3 years, our violent crimes have gone down by 26%? We also have one of the lowest crash rates, particularly in counties of 100,000 population or more. We have the highest rate of seatbelt use, and our traffic fatalities are down for the last 4 years by nearly 50%. That's great news, and we want to keep it that way. That's why we're asking you for your help, because I know working together, we can continue to keep Collier County a great, safe, and healthy place to live.
Hello, I'm Dr. James Tolano, a cardiovascular specialist at the Southwest Institute for Cardiovascular Fitness and Treatment, and the president of the Collier County Medical Society. On behalf of the Society's 500 physician members, I would like to congratulate the residents of Collier County on achieving #1 status in health outcomes for the state of Florida. Since 1957, the Medical Society has taken a front seat approach to creating a better healthcare delivery system, and we are pleased our contributions help the county's effort. Working hand in hand, we support the Public Health Department's goal of maintaining this top position. With this in mind, the Medical Society will continue to advocate efforts that improve access to quality medical care through its legislative connections and at free public events like our health fair, Women's Health Forum, and the cardiac screening during physical evaluations for our student athletes. Plus, we believe it is essential to support our county commission as they explore growth in the areas that will affect the health outcomes like personalized medicine, pharmacogenetics, and biomedical village, namely the Jackson Laboratory Project. Medical Society members will continue to improve factors that influence health outcomes through volunteer work at agencies like the Physicians-Led Access Network of Collier County, which coordinates donated care by physician specialists, and the Neighborhood Health Clinic, both of whom provide vital medical care to underserved or uninsured residents. We are also spearheading new programs that will study ways to improve healthcare access for Medicare patients, engage high schoolers through a mentorship program, offer members more CME opportunities at scientific forums, and allow us to become a hub for a regional healthcare information network in our area. All we accomplish as physicians and as an organization cannot be realized without a strong public health system and strong support from our county commissioners. We believe the health outcomes of our community are a direct result of leadership that inspires us to not only set the high bar, but also exceed in every day. We praise all who have contributed to the health of Collier County citizens. Thank you.
The Health Department plays a direct role in Collier's health outcomes in several ways. One way is through direct clinical services. One of the measures in the University of Wisconsin study is morbidity or illness. The Health Department provides clinical care for certain infectious diseases such as HIV, TB, and sexually transmitted diseases. We also investigate reports of over 50 other infectious diseases to assure that cases, and depending on the disease contacts, have all been appropriately treated. If not, then we treat those people to assure that further disease does not spread into the general population. We provide all childhood immunizations and certain adult immunizations to truly prevent people from becoming ill. Another morbidity measure in the study was low birth weight of infants. The Health Department, together with the Women's Health Foundation, county government, Collier Health Services, and Naples Community Hospital, work together to assure that every woman in the county has access to quality prenatal care and delivery of her infant. Our health department staff provides home visits to those pregnant women most in need of support and follow-up. And our federally funded WIC program provides supplemental foods to low-income pregnant women and their infants. These efforts directly affect Collier's low birth weight statistics. The health department has also been addressing some of the health factors in the University of Wisconsin study. One of our roles is to be the convener of groups to address health issues. An example is our efforts to decrease smoking. We've worked with our Collier County Public School System and students working against tobacco. Several years ago, that work helped make all school campuses tobacco-free. All the hospital campuses are now smoke-free as well. We have regularly scheduled smoking cessation classes available at the health department. Concerning obesity, we are collaborating with our partners in comprehensive planning to strengthen growth management codes to provide for additional sidewalks and bike paths, access to public transit, and preservation of green space for recreation. We are advocating for growth-related policies to help ensure that we all have the opportunity to lead healthy and active lives. We also see it as our role to make the community aware of important public health issues, such as the effect that obesity and lack of exercise have on both morbidity and mortality, the importance of keeping children and adult immunizations up to date and getting a flu shot each year, the increase in mosquito-borne diseases we're having this year.
Hi, I'm Dennis Thompson, Superintendent of Collier County Public Schools. Recently, Collier County was ranked #1 in health outcomes for the state of Florida. I would like to extend my congratulations to Dr. Collier and her team at the Collier County Health Department, as well as the many agencies and individuals throughout the county that contributed to this achievement. Let me take a few minutes to highlight how Collier County Public Schools has contributed to this achievement. Research has shown time and again that individual education levels are directly correlated to healthy lifestyles. Therefore, the most important thing we can do is improve student achievement and development. Over the past few years, we have been able to accomplish the following items to contribute to healthier lifestyles in the county. We've increased the high school graduation rate by 5%. We've increased the overall percentage of students proficient in reading and math by 10%. We've maintained all of our schools' related arts and extracurricular programs. We've provided a free breakfast for all students each school day and partnered with the county to provide over 300,000 meals to students countywide each of the last 2 summer breaks. We've maintained our partnership with Naples Community Hospital to provide school nurses and athletic trainers when many school districts throughout Florida have lost them. We've worked with Drug Free Collier to reduce teenage alcohol and drug issues to include highlighting the dangers of prescription drugs. We've also worked with the Collier County Health Department to vaccinate our students against swine flu. And finally, we spent 2 years with our school district employees to develop and implement a true healthcare reform model that emphasizes prevention and early detection of disease and healthy lifestyle choices. We are proud of our part in helping Collier County be ranked #1 in health outcomes for Florida, and we look forward to helping the county achieve even better outcomes in the future.
I would like to first congratulate Collier County on this achievement, which represents the superior work of the health department, our doctors, hospitals, many other healthcare providers in our area. Physicians Regional Healthcare System has 2 hospital campuses, several primary and specialty clinics that are committed to the overall health and well-being of Collier County. As the newest hospital care provider on the Collier County landscape, we've introduced new technology, expanded our medical and surgical services, broadened our base of doctors, and improved overall quality of care. The results, we believe, have contributed to these rankings. In addition, we've placed significant emphasis on providing a full scope of educational and healthcare screenings programs to our community on a weekly basis. Knowledge is power, and we strongly believe in providing residents of all ages with information on the implications of certain health behaviors, treatment options available when faced with a medical condition, and how to live an overall healthier lifestyle. We also place emphasis on specific key service lines, such as women's services. This allows us to target and bring educational opportunities to young women through prenatal classes and other programs, and then follow them along with their families throughout their lifespan. Today, our community has access to some of the best technology in the world, better access to emergency and primary care services, more choice in healthcare providers, and more knowledge to prevent unnecessary medical encounters. And this is in keeping with our mission to enable America's best local healthcare.
The word last February
from a respected healthcare organization was excellent news for all of us who live here. According to the prestigious Robert Wood Johnson Foundation and the University of Wisconsin Population Institute, Collier County has the healthiest residents in Florida. Congratulations, Collier County. The fact is, Collier County truly is a healthy place to live. Consider these facts. Collier County residents have the 4th highest life expectancy in the United States. There is a 10-year difference in life expectancy depending on where one lives in Florida, and Collier County has the highest life expectancy. For the first time, every person can compare the overall health of their county to the health of other counties in Florida, and we also see where we need to improve. Each of us in Collier County should be pleased and proud to be part of a healthy community, which benefits all of us individually and collectively, and we should all embrace the challenge of becoming even healthier in the future. How does a healthy county translate to the social, economic, and overall future of our area? Like the rest of our country, we have been struggling lately. I believe the news about having the state's healthiest residents can become another factor to persuade folks already considering coming to Florida to choose Southwest Florida first. Please don't misunderstand, we are not perfect. We have much to do through public health efforts to promote better nutrition, fight obesity, encourage exercise, and smoking cessation. We have large areas of poverty. More than half of our Collier County Public School students need free or reduced school breakfasts and lunches. These same students and their families have limitations in getting access to health care. Access to good health care remains a concern, even though we have a network of providers such as the Collier County Health Department, the Women's Health Foundation, CHSI, Community Health Services, Senior Friendship Center, Neighborhood Health Clinic, Healthy Kids, Horizon Health Clinic, Plan, Physicians-Led Access Network, and the approximately 1,000 physicians in Southwest Florida who care for everyone, whether or not they can pay. Obviously, hospitals are part of the solution. At the NCH Healthcare System, our community board of 24 members directs our team of more than 3,800 colleagues, including 630 physicians, to care for everyone. Healthcare is the single largest economic engine for Southwest Florida. I hope we will capitalize on this precious resource as an opportunity and not take for granted our healthcare quality, access, and cost structure. Our Chamber of Commerce and Economic Development Council are migrating from our primary resources, namely sunshine and an advantageous tax structure, to sustainable endeavors which will add incrementally to Southwest Florida's economic output. No measure is perfect, nor does everyone agree on every metric for processes, outcomes, or quality. But there is a pattern, a trend, on objective data for everyone to see. We as a community need to use this knowledge to our advantage to grow in ways that sustain what we cherish: our health, our economy, our environment, our lifestyle, and our sustainability. Our challenge now is to ensure that the residents of Southwest Florida continue to set the standard in healthcare for our state. Meanwhile, the facts about Collier County's healthiest status are outstanding news for all of us who live and work here. So take a bow, you've earned it.
Working together to sustain excellence. Congratulations, Collier County.